Okay, hi, I'm Nikki. I will be playing the role of the clinician doing an oral mech exam on a client with Flaccid Dysarthria.
And I'm Lindsay, and I'll be portraying the patient with Flaccid Dysarthria.
And Lindsay has Flaccid Dysarthria, but specifically it's bilateral lesion in the brain stem. Okay, we'll go ahead and get started. So thanks for coming in today, Lindsay. We're just going to do an examination of your oral structures, how they're working, and we'll use that as kind of our baseline to where we go with therapy. So first I'm just going to take a look at you straight on, and all we're doing is checking for facial symmetry here. So don't worry about doing any work for me. You just take a look. Okay, good. Everything looks to be symmetrical. That's common in patients with Flaccid Dysarthria since it was a bilateral lesion. We are going to start with your jaw and your teeth. So if you could just move your jaw forward and backward like this. Okay, good. Take a quick look at your jaw at rest. Again, don't do any work. Okay, I notice it is drooping just a little bit. That's also common in those with Flaccid Dysarthria. And we'll go ahead and have your jaw just move side to side. Okay, that looked to be a little bit tiring for you, but that's normal. The weak and limited motion is common in those with Flaccid Dysarthria. Okay, we're going to go ahead and take a look at your tongue. So I'm going to have you stick your tongue straight out for me. Just try to touch my tongue depressor if you can. Okay, good. And we'll go ahead and pull it back in your mouth like this. Maybe do that one more time with my flashlight just so I can get a really good look for you. Okay, good. There was some movement there, pulling it back. Good. And we'll go ahead and move your tongue side to side. And I'm going to have you try to touch the depressor again for me. Okay. I'll try this one. Okay, I see some movement there side to side. Again, we're limited, but that's also common in patients with Flaccid Dysarthria. Okay, we're going to take a look at your lips. So I want to take one more observation at rest. So I'll give you a break, don't do any work. Okay, good. Again, it's symmetrical. We're just a little bit separated from that hanging jaw. And we'll go ahead and do a kiss face with your lips. We'll pucker like this. Okay, good. I saw some movement there. And we will go ahead and retract in a smile. Okay, and we're going to go back and forth 2 times, pucker to a smile like this. Good, good. I'm glad you're trying so hard. I know this could be tiring. The slow and weak movements, again, are common in those with Flaccid Dysarthria. I'm going to go ahead and check your pharynx, your throat area. Is it okay if I use my tongue depressor in the back of your throat to check for a gag reflex? Okay, I'm going to have you open up. Okay, no gag reflex. That's also common in patients with Flaccid Dysarthria. Are you experiencing any pain in your throat or the back of your neck at all?
Yeah, a little bit.
In both? Okay, I'll definitely make a note of that. That's also common with Flaccid Dysarthria. And take a quick look at that hard and soft palate, the roof of your mouth. And I want to just take a look at rest again. So I'll give you a break if you can open wide for me. Okay. The soft palate does seem to hang down a little bit. That's also common in those with Flaccid Dysarthria. So to do one more check of that, I'm going to have you just try some sounds for me. We'll do 3 short ahs. Ah, ah, ah. And I'm actually going to use my flashlight and take a look. Okay, go ahead. Ah, ah, ah. Okay, good. It does still hang a little bit lower than we'd like to see, but that's also common in those with flaccid dysarthria. We're going to do one long ah. We're going to have you hold it out as long as you can. And it does help if you take a nice deep breath beforehand, okay? So it'll just sound something like ah, okay, good. That was a pretty long duration. Good. I did notice we did still have some issues with respiratory support, and it was a little weak, but that's also common with those with flaccid dysarthria too, okay? I'm just going to do one more check of some sensory along your jaw. Come back to that. If you could close your eyes. I'm just going to ask you to let me know if and when you feel me touching your face, okay? And open your eyes. Did you feel anything? Okay, yeah, I just wanted to double check that. Sometimes that loss of sensation is also present in those with flaccid dysarthria. So that concludes our exam. We'll take this data and start putting a treatment plan together for you, okay? Thank you.